my god, I can't see. Hi! Can you hear me? Oh my god, my hair. I'm like, I can't see because I don't have my glasses on. Figured I'd go ahead and try this shade on. Let me see here. Where's... There she is! Ta-da! I probably have to close my window, so let me know if I do. Wait, why didn't... Oh.
Hi! Oh,
Hi!
Hello! Let me adjust my thing. Hi, good evening, after morning, whatever.
Good, yeah. good world, whatever it is in the world.
Whatever time it is. Hello, I just saw your email because oh, my chair. I've just saw your
Yeah,
email.
you know, I was just going to grab my laptop because I was putting this on and I'm like, oh wait, I've got to be like really precise with this.
I'm like not even wearing lipstick, no makeup.
I don't know, I just felt like today, like I wanted a red-ish
It looks
lip.
cool. It works.
I
It
love
totally
it.
works for you.
This color, and there's that crucifix color by what's her face. Oh my god, I love any kind of a vampy.
Yeah,
Or
it, like,
brown.
it works for your coloring. I'm not very daring when it comes to like makeup and stuff. So, yeah, I'm kind of lame. Especially right now, 'cause I'm gonna go to bed soon.
You're not lame because I was the same way, and it was me watching like the Katie Jane Hughes, the Celine Bernards, the Harry whatevers, you know, and watching them do shit, and I'm like, you know what, I'm gonna play at home, fuck it, and I started playing at home, and I'm like, all right, let me post a photo, see what people think, and oh my god, that color looks, I'm like, you know what, why not?
No, it looks cool. Absolutely. I'll wear
Let
red
me
tomorrow.
the laptop really quick because we got some killer questions that
I'm just
yeah.
looking at them now.
Oh my god, they're so good. So good. So good. So let me just grab this baby, which is right here.
You, can you all see what's behind me in my kitchen? Doctor, are you ready? Yes, it's Nat Nicole. I'm probably not even pronouncing your name correctly.
Oh yeah, it's Tasha. Tasha. Tasha.
Do we know you?
I know Tasha.
Her name's supposed to say something. It's Nat.
Yeah, it says it's Nat's Nicole. I'm not sure.
That means something.
I want to think, okay, so her last name is Cole. I want to say that it's because her name is maybe Natasha.
Oh yeah, okay, I get you.
Yeah.
I'm gonna start saying that stupid.
No, I do the same thing because I'm looking at people's names going,
oh, it's Nat's Nicole. Yeah, she's like spelling it out for me.
oh, it's Nat's Nicole. Okay, I didn't even know that. The more you know.
Nicole. Oh,
okay.
right.
Oh, I love your name.
Yeah,
Natasha, like that. That's cool as hell.
that is cool. That's definitely a spelling error waiting to happen right there.
Yeah.
That must be annoying when you're like
one.
on the phone. What's your name? It's Natasha, Natascia, and everyone's like writing it wrong. Yeah, that happens to me all the time. Natalia.
Well, yeah, and that's kind of like my last name, which is just, I've got all the letters, and people are like, but, oh, so it's not, I'm like, no, it's.
Oh, my hair.
Yeah,
totally. Hi, Emma. Emma, you are giving all my patients very good advice about products, by the way. I've had like 3 emails today from patients saying, yes, I spoke to someone on Emma because everyone, you know what's funny with Instagram is everyone's like, spoke to someone. I'm like, oh my God, you spoke to Emma? They're like, no, Instagram. I'm like, oh, okay.
Yeah, I'm actually very grateful for Emma, and I wanted to actually say this because for me, actually, let me grab it.
Emma, you should do a live.
I've been asking her to, Little Miss Poop.
Emma, you should have a Dr. Natalia Facebook group. So you can recommend all the products that I don't actually tell anyone about.
Yeah. So,
because I don't like recommending products.
Oh, yeah, and for people that are terrified of coconut oil, this is for you. I do love the texture. I like the way that it feels on my skin, but for me, I find that I have to work a little harder to take off my waterproof makeup because I've got like cemented, tattooed shit that I put on my eyes. So
it's
for
hard
anyone,
to get makeup off of it.
Oh yeah,
Yeah.
and for whatever reason, the coconut oil just takes it right off. But I know that people are just so, no, coconut oil breaks out my skin. So for those of you that feel that way, this is going to be good for you, and it feels so nice just
So,
on
and
the skin.
Lucy had a good question this week because she asked me, she feels like there's still a film of like a moisturizer on her skin, which is what Albolene leaves on after you like remove it. And then she asked me whether that affects the tretinoin and how it would work, like if it wouldn't be as effective. I don't think so. I can't give you a good explanation for why I don't think it does, but I think it's fine. Yeah. I'm not answering that very well, but that is a good question, though. I thought that was a very, very wise question.
And yeah, because that was one of the questions that I think I asked last week was, does
Um,
putting any kind of an ointment or moisturizer before or after Tret affect Tret? Does it dilute it?
yeah, probably not. I think it's more because it's occlusive. Like Albolene is like it gives you this occlusive film because it's like an ointment almost. Then would it stop the tretinoin from kind of getting into your skin? I don't think so. But again, no one's ever done this as like a study, except when I use it myself, I don't find that it's a problem. So yeah.
And for those of us that don't really know what occlusive means, because
Oh,
I know
sorry.
that you get that too. No, 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 no. I get that a lot too. It's like, what does
Yeah.
occlusive mean? I'm like, I'm not really sure.
So yeah, so occlusive means that it creates a barrier. And I took out my lip balm because lip balm is a really classic occlusive. Vaseline is as well. Anything that creates a barrier to water loss. And the number one occlusive, the thing that blocks the most water loss from the skin is Vaseline. So Vaseline is your trait, like the number one most occlusive product of all time. And so like lip balms, you want it to be occlusive, like lip gloss, because you want it to
Yeah.
stay on. Yeah,
Yeah.
unlike a cream that just kind of the water kind of
Disperses. Evaporate.
dissolves. It doesn't dissolve, sorry, evaporate. Oh my God.
Evaporate. Okay. Yeah,
Evaporates.
yeah, yeah. For some
Yeah, and
reason
then
it
it
clicked.
doesn't
I'm like,
leave,
oh, okay.
yeah, it doesn't leave like a film. So when you want a moisture, because people say, what's the best moisturizer? I'm like, well, the best moisturizer is the one that leaves the most water in your skin, and that's going to be like Vaseline or an ointment or something really greasy, which people hate. So, most
Yeah,
people. Yeah.
yeah.
So
And it's funny because you've been saying to me, just put something, at least just one simple ingredient. So I tried the coconut oil, which for me seems to just, I have this thing where it has to absorb into my skin because, like you're
yeah,
saying, a lot of us
yeah.
don't like that tacky feeling.
Happy
But
feeling. Mm.
on these really dry desert days, at night, I have put like the Aquaphor on. I don't have any more Vaseline, so I got to get more of that. I have put just a very sheer layer. And
Yeah.
I wake up in the morning with holy shit skin. I'm like, wow, what? Okay, this is nice. Why is
It's
this so
more, yeah.
soft?
Yeah, you wake up and then your skin doesn't feel as dry because overnight you lose a lot of water through the skin. Just because, especially if you're in air conditioning, which you don't have, but if you're in a dry place, so it's really important. So that's why using a real occlusive emollient at night can be very good. But people really stay away from that because they don't like the way it feels. Someone just asked, can you explain about putting Vaseline after
That's the
tretinoin?
afternoon.
Yeah, so you can use any, no, I don't know how to get rid of that now, that's annoying. You can use any kind of ointment on top of tretinoin, it's fine. You don't have to wait for like an hour or anything like that. You can just whack it on there. So that's
And
fine.
for anyone asking questions, let's hold off until a little later because we got a lot of really good questions and your answer might be there.
Sorry, I just screwed up my screen again.
And I actually have the question, so I have them on my, if that helps.
Yeah,
It's Nat Nicole. She wants to know about lip masks, face mists, face masks, and eye creams. Are they
yeah.
BS? Will they actually do anything? Let's
Lip
put it
mask,
this way.
yeah.
I'm gonna make it even better. Will they do anything long term? Because that's the true question.
Yeah,
Will
that's
they
true.
do
You're
anything
correct.
long term?
Completely correct. Because short term, everything will do something.
Yeah.
Yeah, so the answer is no, nothing long term. So I'm just reading it off my computer. Lip mask, face mists, face masks, and eye cream. Yeah, I mean, eye cream is just moisturizer. So, you can just use normal moisturizer. That's fine. You don't need to use eye cream because it's just a waste of money. But so, and
Or
I don't even know,
nothing.
I don't know what a lip mask is.
Okay, so they're doing these things now, which really pisses me off with lip scrubs which I've been told that's like an endless battle with your lips because you have layers upon layers that will just keep peeling off.
Yeah.
And they have lip masks, which are supposed to basically do that. They're supposed to do a combination of either or, plump the lips, moisturize the lips, or make your lips not look basically crusty in the morning. And it's like, guys, Vaseline, hello.
Is it lip balm? Like, is that called lip balm? Like, I
Thank
always use lip
you.
balm.
And people, I'm going to actually get one of them that's like really well known because people are buying this crap for like $25, a little tiny thing.
That's a
And
thing?
oh my God, I ended up getting one in my BoxyCharm and I'm like, what the fuck is this? So I figured I'd try it and I'm like, this doesn't do
This
anything.
is lip balm. Yeah,
It,
yeah, I don't really follow these things that much. These ones don't come on my radar, so it's good that you're telling me about lip masks. That's so funny.
lip masks and lip scrubs. Please tell them about lip scrubs while I grab this stupid little thing. Because
But a
lip
lip,
scrubs are a joke. Oh my
I don't
God.
think you don't need to scrub your lips. If you have really dry lips, that's kind of a different issue. So I would probably advise not to use a lip scrub. But yeah, I don't know why yeah. Just use lip balm. I'm not gonna spend $25 on a lip balm that you're supposed to wear overnight. That's it? That's a little lip balm pot.
This is like, and look at the bottom. It's like really hollow. So this little guy is called a lip sleeping mask. Actually, I
Oh,
have to get my bigger glasses because this is too small for me to read.
honestly,
No.
can they come up with some other crap that you need? A lip
Oh my God.
sleeping mask.
They come up with like all the crap. So this says,
Has anyone else bought this? You can.
oh,
I will not laugh at you if you tell me you bought a lip sleeping mask.
I'll giggle, but I can't help it.
Is that sold for grown-ups?
It's like, come on, people. Okay, I'm gonna let you do it, but I know from the marketing side,
It's great marketing, but it's brilliant. It's like so good.
so annoying.
I have a lot of respect for these marketing people. Like,
They're
yeah,
creative. They're creative as
they're
fuck.
creative, man. I mean, people come up with this stuff. It's like very creative. I'm just zooming through the to the quick questions, but yeah, no, I'm gonna. No, wow, lots of lanolin as a moisturizer. Oh, that's a good one. Oh wait, before we touch on that, someone named. Oh my God, I can't read this.
Oh, hold
Almond
on.
Jock.
Uh-huh.
I'm skipping ahead. It says, would these type of occlusive ointments like Vaseline be okay for acne-prone skin? Wouldn't it be too occlusive? Now, that is the million-dollar question, because I think everyone has a fear of using greasy things on their face because of a fear of getting acne from it. Now, that idea of what you're talking about is called comedogenic. So that's something clogs pores. That is a very complicated topic, and it's been really confusing for many, many, many years in the world of dermatology. But it was about 20 years ago that was kind of, I don't want to say disproven, but disproven, where the Vaselines and things were found not to clog pores, because the process of forming a comedone or clogging a pore is much more complicated than something you apply externally. So it's not that simple, like put coconut oil on skin, clog pore. It doesn't really work like that. And I have to do a whole video of this because it's actually quite a complex process. And I'm sure some of you would actually want to watch a 10-minute video about comedones.
I'll watch a half-an-hour video on this,
Yeah,
please.
some of you might actually want to watch it because it's quite a long story. But I think the one thing I would say is that, this is a study that I think you once asked me about before, but there was a study done where they took a group of people with acne, and they gave one group pure Vaseline to use twice a day as a moisturizer for 8 weeks. And they gave the other group a 30% Vaseline. So it was like, as in if you took like Vaseline intensive care, the moisturizer. So they used that instead. So it wasn't like super greasy. So it was like a normal moisturizer. So that was like the control. Okay, so they used a normal moisturizer, and then they used Vaseline, like pure Vaseline. And they had these acne patients apply it, one group twice a day. They both had to apply it twice a day to their entire faces. They had to be paid to do this because you can imagine acne patients, they wouldn't do this just willingly. So, and they actually showed in the study that the patients who used the pure Vaseline, their acne improved more than the patients who used the normal moisturizer. And that was like a groundbreaking study because it was pretty phenomenal. Yeah, so they did not get worsening acne over 8 weeks of twice daily Vaseline. And who uses Vaseline twice a day? Like, I didn't even use an ointment twice a day.
Yeah.
You know what I mean? Yeah, so it's like that was pretty hardcore. So that, I mean, I have to do an Insta post about that.
You know what? My cousin's friend did that. Her
Okay.
skin, she's like 10, 15 years older than me, and she fucking looks 20 years younger than me. I'm like, what is with your face? Well, when I went outside, I wore sunscreen, which I never
Yeah.
did to lay out in the sun. I never did.
Okay.
And then, yeah, she did the Vaseline thing, and I'm like, how is your face not destroyed?
Well, Vaseline is a really interesting product because it's not only like 99% occlusive, so it totally stops water loss, but it also has like anti-inflammatory properties. It's kind of one of these interesting all-arounders, and it's really like a hidden gem, I think. But like some people don't like the smell of Vaseline; they think it's too occlusive. So using a similar paraffin-based product, like an ointment, is going to give you the same type of result. But yeah, I mean, I think we need to get away from being scared of these really basic products that have been around for a long time. They're quite good generally. So anyway, sorry.
So basically, like okay, so for everyone asking, because I've seen them rolling up in the questions, Vaseline, Aquaphor healing ointment, CeraVe healing ointment. What are the others? Coconut
There's
oil.
Aquaphor, coconut oil.
So
There's
all of
a
those,
lot of
they're
ointments.
fine, right?
Yeah,
And for
so
you,
yeah.
yeah, and for
Aquaphor is
your
just
area, QV.
yeah, QV. So so can you explain how to apply Vaseline? Just apply a layer of it on, slap it on there. You can be generous with it. Um, Yeah, creme de la mer is Vaseline and mineral oil based. It is indeed. Mineral oil is also a very good emollient and moisturizer. But La Mer, but no, the thing is, Nick, most moisturizers are. So if you look at the ingredients, it's like paraffin, which is basically petroleum, mineral oil. That's why when I say that like they're all the same, I legitimately mean they're like all the same. Like
They're
literally,
all
if
the
you look at
same,
creme
just
de la mer,
diluted for
they're all
for
basically the same.
moisturizers.
Yeah, they're basically
Yeah.
all the same product. Lanolin is a similar type of occlusive, and lanolin is derived from sheep sebaceous glands, so sheep oil. So lanolin is not vegan. So if you're vegan, you'll never use a lanolin-based product. But lanolin in and of itself is not a bad product. It's good. It's an occlusive.
So here's why I stay away from lanolin, and tell me if I'm wrong.
Yeah.
I have because I used to grow, I grew up back east, and we would, we went to, I don't know, we were petting sheep, and my hands broke out with eczema.
Okay.
So I thought, oh, all right, well that means that I'm allergic to lanolin. Not necessarily, right?
No, no, it'd be difficult to be allergic to lanolin because it's not, well, no, you can be allergic to, sorry, just kidding. Yes, you can. Actually, no, sorry, back up. It's been a long day. Lanolin is the one emollient that is the one that can be prone to an allergic contact dermatitis. Sorry, you're right. So yes, you
Because
could
it's
have
an
been allergic to
animal.
it. Just
Okay.
everything I just said, just forget it. But
Okay.
yes, you can be.
Well, no,
Lanolin is the one. It's because it's derived from animals. That's why. That's why
okay.
it can be allergenic. So you're right. You may be
And
allergic to
since
lanolin.
we're thinking really heavily on like really potent oils, what about castor oil, shea butter, cocoa butter? Are all of those okay on the
I think
skin?
so, but I haven't yet done my castor oil research because I had someone ask me that and I haven't looked it up yet. But shea butter I think is fine. Yeah, all these vegetable-based oils. Olive oil is not though. That's the only one that's really exceptional because olive oil is a feeding ground for Malassezia, just the nature of the type of oil it is. Malassezia is a yeast that lives on your skin. So, and it can cause dandruff. So you shouldn't put olive oil in your hair. Olive oil
So,
is a
you
bad
know how
one.
you get those little bumps on your arms?
That's different. That's keratosis pilaris.
Okay, when I used to use olive oil to moisturize my skin, because I'd heard from Italians it was the thing to do,
Yeah.
I ended up finding that 3 days after doing that, that went away. What in the
Yes. What is it in the olive oil? I don't know. Had you tried a different oil?
No, but I'm gonna now. I'm gonna try it with coconut oil and see what happens.
Try a different oil, but on your body it's a different thing. But on the scalp and the face where there's already yeast, you don't want to add it on there. Oh my God, Russell Bell joined.
Who's Russell
Sorry,
Brand?
Russell. Is it the same Russell Bell because he's just joined back on Instagram? Because our TV show's coming on. Oh
Oh,
yeah,
cool!
that's right. Yes,
Hi, Russell.
totally random. Russell and I filmed like this docu-series last summer about skin surgery, and he was like the one in charge of the clinic. Russell, if it's you, it is Russell. Okay. So Russell's back on
Seriously?
Instagram. Hi, Russell.
Cool.
Yes, hello. So Russell and I did this docu-series with a couple other doctors, but we're the main stars, obviously. And it was just picked up again, and it's going to be showing on UK Channel 5 Star in July, the first 3 weeks of July, and then it's also been bought in the USA, so you're gonna be able to watch it.
Oh, good.
In like Italy, Spain, Benelux, Poland. So it's gonna be showing in different countries, our show. So you have
Yeah,
to
because I
find it
tried
and
to
watch
watch
it.
that podcast that you, let me see if I can adjust this thing. I tried to watch that
Yeah.
podcast that you told me about and it wouldn't let me. It said, no, you're not in the right, you're, you're restricted. So I
Oh,
was like,
that's
okay.
weird. Yeah, so Russell Bell is the face of the show. Yes, yes, Russell, you are the face of the show.
I
But
can
yeah,
almost hear
so
him, honey. I'm the face of the show.
face of the show. So it's about it's a skin surgery show. It's basically us removing funny, weird skin lesions from people's bodies. It's the name and the name they're going to use in the US. I think it's called People Like Pus.
Ew! Oh,
And in
gross!
the UK, it's going to be called, in the UK, it's called Skin A&E. So Channel 5 Star, it's the first 3 weeks of July, one every week, and it's called Skin A&E. I'm going to be putting this all over my Instagram, obviously, so if you
Oh,
didn't
yes,
catch it,
please, please. But
but
is it really gross?
yeah, it's, Russell, is it pretty gross? Yeah, it's pretty gross. My
Oh,
brother's already emailed me and said he's not going to watch it because it's too gruesome. If
I
you,
don't know if I can
you
watch
go,
it. Shit. I can't
you go
stand
on
puns. I
YouTube.
can't stand. I don't understand how people watch those shows. Pimple poppers. Oh God, no.
Yeah, it's kind of like the UK version of Pimple Popper. Oh, airing
Yeah,
on the
no, I can
2nd of
watch it.
July on Channel 5 Star, Russell. Is that right? The 2nd of July on Channel 5? Yeah, so the gross programs, you're going to love it, Nicole. Or
Nicole's
Tasha.
like,
Like,
yes, please,
you
more.
are going to love it. Yeah.
I'll watch surgeries, but I can't watch stuff where, yeah, no, that's gross.
Yeah,
Ugh.
you guys have to watch me. And I don't need any criticism about the fact that I don't wear a mask with every procedure. In skin surgery, and this was a year ago, guys, so it's not even COVID time. We don't wear masks in skin surgery because it's not that kind of surgery. So please don't harass me on, because I got,
You're not wearing a mask.
please don't say, oh my God, you're not wearing a mask. Yes, I know I'm not wearing a mask. We don't wear masks in skin surgery. And also no one comment about my nails because I like, my nails look, well, they look crappy now, but I usually have nail polish. So please,
Oh,
please
yeah, mine look crappy
yeah,
now. I'm not even
please
worrying about
don't.
it.
I know I shouldn't have been wearing nail polish. I know. Anyway,
Actually, no, because
um,
now, wait, is it nail polish that you're getting done, or is it nail is it like the gel and stuff?
yeah, I get gel, but
Then it doesn't matter.
it, well, it does to people on TV that when they watch it, they don't know it's gel nails, but they're
Oh,
gel
so
nails,
they
guys.
freaked
They're
out.
gel nails, and Russell wears a fabulous bow tie. So please don't slide off his bow tie because he looks so cool and it's his style and he is styling. So
It's like a Bill Nye bow tie. Oh my God, Bill Nye is so
yeah,
cute.
so I don't need that kind of harassment. And because the show was so good, because I remove stuff from people's bodies and it really changes their lives because they have weird growths and stuff that they need removed. So just focus on that and not on like how bad my hair looks.
Oh, and I totally understand that because I had a huge skin tag right here that I finally got removed, which I was told to only put Vaseline on.
Yes,
And
correct.
yeah, it healed really nicely. So it was horrifying. But yeah, and even I had a little cyst right on my lash line that I had
Yeah,
removed, which was painful as fuck. And that's amazing. But no, I can't watch. I can't, that shit, I
you
can't,
can't watch
no,
it.
no, I
Oh,
can't watch
Annie
it.
has just asked a really good question. Are gel nails dangerous? A dermatologist once told me they can cause finger cancers because of the light. Yeah, that's because they use UV light to set the gel. Most gels actually are LED light now because of that. That was one case report of 2 women who had used UV gel on their hands or acrylics on their hands for like 30 years and both developed skin cancer on their hands. The thing is, skin cancer on the hands of elderly people, very common, okay? So to
Oh
make
yeah.
that connection in that case report, it was just stupid. So that's where that came from. So Annie, don't worry, you'll be fine. But then they started selling all these stupid little gloves so you can protect your hands from the light and stuff. Yeah, I know. So
They'll find
obviously,
anything to sell. I swear to God. You
yeah,
guys, if
they'll
you
find
guys complain about anything, they will make something up and sell it and tell you you need it when you fucking don't.
yes, they'll make up stuff to sell. So Annie, no, don't worry. Oh, Russell wants to join. He wants to say hello.
How would we do
I don't know
that?
how you do that. Can you have more
I'd
than
have
2
to get
people
rid of
on the
you
line?
though.
I think she would.
Oh my God, you know what? We should do a Zoom live. Wait, can we do a live?
You can't do a Zoom live because you have to send people invites
You're
or
right.
something. I don't
We
think you
might
can
be
have
able
more
to,
than
I'm
two
going to
people
check
on
and
the
see
live.
what we can do in terms of live like that, whether it's like Google or whatever, and we'll all get on.
Can you do more than one person? I don't know. I've never seen that
No,
actually. Yeah,
no, I
Russell,
can
I
only,
never
I either have to hit the X right now and get you off and add him, or that sucks. They should change that.
They should change that. Oh, YouTube. We could probably do it on YouTube.
Yeah, we could.
Maybe. I don't know.
Yes, yes, yes,
You're the tech person.
because Trevor Noah did it with like,
Who's that?
he's funny as fuck, dude. He's like not as good as George Carlin, but he's like the baby George Carlin.
I don't even know
He's
who.
good. Oh my God. Okay, so I'm not a big comedian fan.
Who's
I'm
George
not. I'm
Carlin?
not. They're funny, but I'm just not into like that whole thing. But my ex is. And long story short, he ended up making me realize that my dad was watching George Carlin when I was a kid because he loves him too. And then boom, he introduces me to all these others, which they're right. And then he introduces me to Trevor Noah, who's from South Africa. Fucker is funny. Funny. And he ended up doing, he does what's called The Daily Show. And he had, I want to say he had like 6 people on live.
Oh, right. Okay, we can do that then. We can still do that.
Yeah.
Totally.
So,
Emma, we're going to get you on there, Emma. We're going to get
oh
Emma.
my God. Yes, Emma.
Yes, Emma. Because you're like this, like, she's like this hidden person who like just gives her, she's like the skin whisperer.
She is a
You
skin
go,
whisperer.
you
I
tell
even,
everyone information and then no one knows who you are. Like,
yeah.
you know who you are, but
Well, she finally sent me photos, and I'm like, okay, you're cute as fuck. Why aren't you? I don't get it. And she's like, well, no, but I'm like, no, I don't get
no.
it. No.
Emma is so helpful. And then I think your picture on your Insta is really cute because it's just like your hair bun, like that.
Yeah, the whole side profile cutting off her face. I'm like, oh my
And
God,
it's
there's
really
artistic.
like, it's artsy and quite cool. So,
Yeah, very.
oh, Russell wear a bow tie. You have to have Russell on. What's that? You have to have Russell
So
on.
this
Yes.
is, I was, remember before I was watching you, I was following somebody else. And I'm still following her, but I don't pay her too much attention.
Okay.
And she's like you, where she's like, this is useless. Use this. And I'm like, okay, so I bought a full bottle of glycerin, and I'm like, what do I do with it?
Glycerin. Just pure
Yeah,
glycerin. It's an
pure
emollient.
glycerin.
It's not an
And
occlusive, it's an emollient.
it's too fucking sticky for my
Is
face.
it actually sticky? I've never used pure glycerin.
And then I found out it's very sticky. And it's very sweet, which I thought was interesting. And I ended up finding out that if you end up putting too much on your skin, you can actually, without diluting it, you can destroy your skin. I'm like,
I don't know much about glycerin.
yeah, so Emma and I have been talking about that, and I've been finding recipes online where you like use like 1 part per like 5 million. So yeah, I'm trying to find something where I can make my own baby wash.
Oh, right. Okay. I'll have to look up glycerin. Maybe we should answer a useful question. So
Yeah, so
someone just
okay,
said to me, your advice is use Vaseline, QV, or CeraVe ointment after trust all over instead of moisturizer. Uh, yes, if you need it, because not everyone needs that much moisturizer. But if you're finding that your skin is dry in the morning, or you just want to try something different, then yes, I would do that. That's what I would suggest. And when you look for an ointment, it is a moisturizer, by the way, because they're all moisturizers. But what you're looking for is the first ingredient is usually water, and that's in a cream-based moisturizer. So in an ointment, water, there is no water in it. So there should be no aqua. Like that's always the first ingredient, and there should be no water. So yeah, there you go.
and for the oily skin people that were asking also, well, do I need to use Vaseline or any ointment after Tret? No, they don't, right? It's only if they feel they need it.
Yeah, only if you feel you need it. And then someone else before said, we missed a whole bunch of questions. I'm really sorry. Someone said, oh, what if it's really hot out and it's like really humid? Well, then you don't use it, because I don't want you to feel like you're suffocating. Do you know what I mean? If it's too hot out, then don't do it. So, but in the winter, just if you live in a country like that's cold, then in the winter, you are going to love using ointment in the wintertime because it will totally change. And
in a desert climate too, like California, Arizona, wherever else there is.
Dubai is meant
Nevada.
to be.
Yeah, Dubai. Yeah. Now we do have some other questions too from like through the magnifying glass. She asked, physical sunscreen reflects or absorbs UV ray? Because I've heard that too.
Physical sunscreen.
Yeah.
Well, it's meant to reflect like a mirror.
Why is it that there were studies where people were saying that some of them actually absorb UV rays?
I haven't seen those, so I'll have to look myself. But I think potentially if you have a sunscreen that's mixed, so you have chemical and physical in them, then you're going to get some absorption as well as some reflection. But yeah, I don't know. I have to check those. They both reflect and absorb. Yeah, I mean, I think I would agree with We Are Bats. I don't know your real name, which is really stupid. I
Yeah,
call you We Are Bats.
we are bad.
Which is really stupid. But anyway, I don't know your name. It's probably like Bob or St. John, or right. Just give us your name. That would be helpful. So, or tell me. But yeah, so I think obviously you're correct that some of them reflect more than others, but all of these sunscreens will absorb a little bit and reflect. Oh, Andre, thank you. It's not John. Andre. Some of them will, like, nothing purely reflects or purely absorbs. Do you know what I mean?
I thought zinc did.
It's meant to. I am not a chemist, but Andre
okay.
is. Andre is a cosmetic chemist, I believe. So whatever he says is correct with regards to this scientific question.
And then also Through the Magnifying Glass asks, and I like this one because this is another marketing myth: dehydrated skin and the need for hydrating layers. So in other words, what she means by that is what I was showing you last week, where you do the toner, the essence, the oil, the serum, the...
The idea that you have to use a toner to prep your skin for moisturizer, I don't understand that at all. That has no validity in any type of like real world. So that's just hello, buy more products spiel.
Not even that, like, because it's actually anywhere from like a 5 to, I've seen some people do 20-step skincare routine, adding layers of just shit on their face. So again, they do this is the required according to many skincare. Yeah. So I want to break this myth because that's one of the questions that she had, and it's again toner, essence, serum, whatever, and then like moisturizer at the end. And I'm like, dude, seriously? Just put a good fucking moisturizer on. That's all you need, right?
Here's some Vaseline. Yeah.
Use Vaseline. Exactly. Problem solved.
I think we have to, just before we touch on that, Andre saying about sunscreen, just to close on that topic, the whiter they are, the more they reflect, correct? What he's saying is obviously correct. That's why I like sunscreen that leaves you with a white film. Because if it's invisible zinc, it doesn't reflect anything. Because literally it's the particles that are reflecting, and if you don't see them, you're probably not reflecting. But yeah, so now, good, thank you. I'm going to just, yes, this whole thing is, to me, this whole idea of using like a 10-step skincare thing is purely to sell product. There is no actual like physiology or science or even just common sense behind that. Like let's not even go into science. Like let's just stay away from science, because when you start talking about science and cosmetic skincare, you just get yourself into a mess because it doesn't make any sense. But if we just talk about like logicalness, which is not a word, so common sense,
logic.
I mean, that's the word, logic. Is it logical to have to apply like 10 different things in layers in order to make the one before it work better and have the one after it? That just doesn't make sense. Like why would you need to do that? I don't your skin doesn't need to have layers of stuff on it. I mean,
and then that's just like Nigat is saying, rose water. People are like, oh, you have to spray rose water on your face, which I was like, okay, what's the deal with rose water? So
yeah,
I'm
why?
spraying. It's supposed to soothe your skin, moisturize, blah, blah, blah. I even think that they're saying that it's anti-aging. I'm like, guys, come on.
Well, it's not going to be harmful. So.
I know, but it's like they're touting all this BS that, I mean, really, what can roses do? They smell pretty.
Yeah, true. I'm so distracted by the questions. Russell, I answered Annie's question about skin cancer of the finger. I definitely said no with the gel. Oh, so Nigat is saying hydration for...
Well, wait, before we go to Nigat, somebody above said something that you were, they were saying, okay, because I remember you touching on this. You mentioned they asked for facials. What about facials? I remember you saying that they actually cause acne.
Yeah, so in the study that was done in this, 1/3 of patients developed acne like 4 to 6 weeks after having a facial, most likely due to the massage and stuff. So this was actually like studied. And when I posted that study on Instagram, oh, I
It
got ripped
blew
to
up.
pieces. I got ripped to pieces by the beauticians who all stopped following me. And it wasn't meant to be an
Oh, you're just telling the
anti-beautician
truth.
thing. Yeah,
Yeah.
even though, to be honest, and if there's any beauticians listening, I value you highly for all the other stuff you do, like waxing, eyebrows, all of that stuff. Facials, I'm not a fan of, and yeah, sorry, but everything else, fantastic. Like, we work as a team. I send patients to you for other stuff. Do you know what I mean?
And
So
for those of you thinking that my skin is acne prone, I have sensitive skin, I'm dry here, I have T-zone. I have never had ever a facial. Never.
I
You don't
have.
need them. I've never
Oh,
had one.
look, there's a beautician following me. Beauty by
Oh,
Anna.
thank
Oh,
you,
thank
Beauty
you.
Hannah.
Thank you. And I don't mind, like, I don't know, like a nice, like, if someone doesn't have acne and they're older and they want like a gentle face massage, like, that's cool with some oils and stuff. I'm all about that. But not like when you have the acne patients and you just go for it. Like, no, like, they don't need all that stuff. But thank you. I'm glad you don't hate me. I'm not anti-beauticians. Yeah, sorry. What about Hydrafacial? Not a fan. Hydrafacials are basically like partially dermabrasion because they basically shoot like sand at your skin. I just don't like people fiddling around. Like, just don't fiddle with your skin, especially if you have acne and stuff.
Well,
Like,
what
it's
about like people that don't have acne, but you know how like, because I've never done it, but I've heard where they go in and they just like
they
remove
extract.
stuff.
Yeah, I mean, I'm not a. I don't think it's necessary. I
What does
think
it
if you
do to you?
have what to reduce like comedones, like for the little, you can just squeeze those out yourself, but they will just refill, and that's why you should use a retinoid to stop them from coming back.
Oh, that's why I haven't noticed them on my face.
Yeah, they're called sebaceous
On
filaments.
the nose.
Yeah, so I actually wrote in one of my posts, this also got me attacked. I said, those pore strips, those Biore pore strips, remember from back in the day? Yeah, those are really great at clearing those little sebaceous filaments out of the nose. It's a temporary thing, and the polymer, the glue just sticks to them. It's not bad for your skin. Oh my God, I got ripped to pieces. Why would a dermatologist say this? I'm like, guys, it's just a cosmetic thing. Like, if you
It's
don't want them
true.
there, just take them. It's not damaging. Jeez, come
And
on,
I
give
like
me
what
a
Anna's
break.
saying. Anna's like, love you guys. You do speak the truth. I like that. See, this is what people need. They don't need fluff. They don't need, well, if you like it. Basically,
Thanks, Valentina. But Tasha is saying, how come then all those celebrities or people that do facials have a better skin texture and appearance? Yeah, I mean, I would first look at their skin in person, not on a filtered photograph. But also, it's not the facials. It's gonna be all the other stuff. Yeah, and that she's holding it right there. It's gonna be the tretinoin and the Botox and all the other stuff, and just everything else, and like the filters. So, oh, thanks,
and
Valentina. The
yeah.
filters and all that stuff. But you know what I mean?
And
Let's see.
consider this too. This does not sell for them and make them money.
Yeah, it doesn't sell
This
for that.
does right here. So by them selling this to you, they get a commission. They get zero for selling you this because this is going to make your skin look good, which I'm impressed. I'm totally impressed. Totally
Yeah.
impressed.
So, I mean, I think celebrities, we have to suspend reality. I mean, like, these people have a whole different set of rules they live by. Yeah, I was just about to say, Nick, J-Lo, her skin's freaking incredible. Like, her
What
skin's
is with
amazing.
her skin?
Yeah, I'd like to have a chat with her about that. Maybe one day she'll come on a live.
She's older than me. She's older. We're
Yeah, she
both
looks
Puerto
younger.
Rican. She's older than me and her skin is pristine. It's
It's
bullshit.
it's amazing. Yeah, she's pretty amazing looking. Like, her body's pretty amazing too. Like
Oh
J-Lo,
God.
she's like goals. Hashtag goals with J-Lo.
Yeah, yeah.
Amazing. Do you think we should ask her? Oh yeah, Russ, can you call her? Russell's gonna call her. I think we should ring her and see if she'll come on and do a Zoom.
Oh my God, Russell, if you could really make that happen, I would love you forever.
Yeah, seriously. Tasha,
Not that
I
it
do think
matters.
it is genetic. It is definitely hugely genetic. Should we do okay? So one of you asked about peels. Um,
Oh
so
yeah.
peels. So peels are interesting because they are very much a cosmetic type treatment as well. So you know, they just take off the surface skin, and depending on the depth of the skin, yeah, I'm ignoring everything about twerking. Depending on the depth of the peel, you may
Sorry.
have no downtime. Okay, we're not going to talk about anything serious. This is not.
Yes,
We're not
we
going
are.
to
Yes, we are. We have a lot of questions, so yes, we are.
talk.
Sorry.
But peels are good. Like I like a peel, a very gentle peel. Like if you're going to go to an event the next day and you want your skin to be extra smooth, or you know, to wear your makeup well. But it's very much a temporary thing, and it's not necessary for healthy skin, in my opinion. And then if you start going to the deeper peels, then you're dealing with things for like acne scarring, and that's where you start getting a benefit from that.
Did you see what Nicholas just wrote?
Yeah,
She
she
never
never.
tells too much, just a cream from her derm. I bet you
I
it's tretinoin.
wonder what it is.
I bet you it's
That's
tretinoin.
it's
Oh my God,
trying.
she got smart.
Yeah, she doesn't mess around. But these people, it's their career to like look amazing. Oh, for Valentina's asking, including BHA. So salicylic acid peels are slightly different, because salicylic acid is a slightly different acid in that it's you know, it goes right into those hair follicles, and it helps with acne. I wouldn't say that it's a treatment, but it may make you feel better about how your skin looks. Same with lactic acid. It's a very superficial thing. So it's as if you're just, you know, you're literally just like removing the very, very top of the skin, and it's going to make it look shiny, and it's going to make it or like glowy, but it's only temporary. So if you like to do it, that's fine. But in my opinion, there's no long-term benefit. Ludic, oh God, I don't know if I'm saying that right. The Cosmoland Peel, right? Okay, so this one is a problem. So the Cosmoland Peel, I would strongly advise anyone with melasma not to have that peel, because it's about 800 pounds for one peel. It's literally like hundreds of pounds. Okay, and when I wrote the groundbreaking paper that I was published in October 2019, because I did my systematic review about melasma, and I did a ladder of treatment. The least evidence-based treatment and the least effective treatment for melasma are peels. Okay, they were at the bottom of the
Ooh.
barrel. Okay, and I went through
Wow.
89 clinical trials of the treatment of melasma, and peels were like low, 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 low. So for melasma, please do not waste your money on that Cosmoland peel. And there's so many ripoffs of the Cosmoland peel with loads of different names and stuff. So any peel made for melasma, and if they tell you something like it'll take away 95% of your pigmentation within 30 days, that is a load of BS. There is
Bullshit, I'll
no
say.
evidence for that. It's crap. Because even if it, and some patients I've had that done it, and it's improved their melasma a little bit, but it always just comes back again, because there's no aftercare involved in peels at all, because they don't sell you that. They just sell you the 800-pound peel. And the thing is, melasma is about aftercare, and it's about maintenance. So you can't just do a peel and say adios. So please don't do it, because then you'll come knocking on my door in 6 months and say, why did I spend 1,000 pounds on this? I
Yeah.
know.
So for melasma, you can't just use HQ, right?
Yeah, of course you can, but with retinoid and stuff. Yeah, so Ludic, I'm so sorry. Yes, Russell, melasma cannot be treated with a peel. The before and afters for the Cosmoland peels are very dramatic. However, they are almost certainly not real, okay? So they're beautifully photoshopped. I have a couple pictures of melasma before and after patients. Those are my real patients. I have one coming this week of a patient who I treated for melasma over lockdown. My pictures are not Photoshop. These are real results, but I would not trust the Cosmoland people. Okay, it's a multi-million pound business, these peels. So I'm so sorry. Just please, like, suspend reality with that. And my paper, if you want a copy of my paper, can you DM me with your email, and I will email it to you. There you go.
Yeah, no kidding.
So,
God. And for those people looking for a glow too, I've been noticing a glow with this,
yeah,
with the
tretinoin will do.
tretinoin. And I'm not going to say Dramatica. So when I'm putting this up, I'm saying tretinoin. I'm not saying Dramatica. Um, I've noticed, yeah, well, because I don't want to sell a brand. Because I've noticed a huge difference in my skin in terms of glow, and I haven't had a glow since I was 30.
You are glowing. Bye, Russell. Bye, Russell.
Oh, bye, Russell.
We'll have
Come
to do a
back.
live. We'll do a live with you. Bye.
Yes, definitely. And
Definitely.
then, okay, so when you're saying for people that want to exfoliate and use a peel, what ingredient should they look for then as a gentle peel? Because I've never even cared for them.
Yeah, I mean, I wouldn't do it. You can do it at home because you can actually go on Amazon and buy these peels, which is interesting. I've done that before just because I was interested. This was like 10 years ago. So and you can buy a pure 20% glycolic acid on Amazon. So, yeah,
Oh,
it's like
so like this stuff, but instead of being in a pad, it's in a peel.
it's
So
in a
this is
liquid
just glycolic
vial.
acid.
It's in a little vial, and then you just brush it on your skin. Yeah.
Okay.
No, it doesn't peel off. You have to
Oh,
then you have to either wash it off or then you use one of those, you have to use a product to like neutralize it. So,
that's too much work.
yes. Oh, okay, so Andre, the rapid retinization, right. So, have you done it, Nick? Yeah, 20% glycolic. You can buy that. You can buy it on Amazon. So the rapid retinization protocol,
My face would be like Freddy Krueger.
yeah, that happened to me with the rapid retinization. You know how I told you, Andre, that I did the 0.25% in the propylene glycol, and I did it one night, and for a week I like was dying. So I'm not doing that again. So basically, I had like super red. It was a real disaster. So I
Yeah,
will
see, I'm
not.
so afraid of doing that stuff. I'd rather just moisturize my skin.
Yeah,
I'm
so it
so
was super
scared of
soon.
that.
So Tasha, you're correct. I wouldn't trust cosmetics on Amazon. I totally agree. But I'm just saying that you can literally buy these things on Amazon. So if you're going to like a beautician who's doing it for you, not that beauticians would do this, but you can just buy it for like £5 on Amazon. So yeah, anyway. So Andre's doing a rapid retinization. He's doing it really well. He can cope with it. I
Yeah, but
can't
he's got
cope.
a baby face. He's like really, really young. He looks young. Are you young? You're really young,
Yeah,
right?
he's young. It's my
Yeah.
skin is super, super sensitive to tretinoin. So that's just why I couldn't do it. One day and it was like game over. Andre, I cannot believe, are you in the middle of your second week now then? Because bloody hell, it was one night and I had to wash it off at night because my face was burning. I have really sensitive skin though. I'm not sensitive
Hey,
skin. I just
that
don't react.
first aid beauty stuff burns the crap out of my skin, and it's just a pad, and I'm terrified to use it. I wash it off.
It's like one of those glycolic pads.
Yeah, and I've been using this one because it's gentler, it's not so mean, but like I haven't even tried this yet because I'm terrified. I'm terrified.
I got those in my, oh my gosh, I got those in my advent calendar.
Oh, you did? And
I was like,
they
I'm not using this.
burn. I mean, do you notice something? Yeah, your face gets shiny, but my God, do they burn?
Yeah, they burn. I mean, I think a lot of people have different tolerances for different things. When it comes to acids, like I like an acid, and I like acids for specific things. Like I like a high strength glycolic for keratosis pilaris for the body. I like strong acids for body because it exfoliates, it makes things smooth, and it moisturizes. Yeah, like upper arms, like a lactic acid, glycolic. Not a huge fan for it on the face, except in very specific situations. Because if you're already using a retinoid, which most of my
Yeah.
patients are anyway, then to throw in, if you throw in a glycolic, it might be too much. So if I do that, I add it in slowly if the patient needs it. And I sometimes do it for pigmentation, but there's not a lot of reasons why I would use a glycolic in a patient. I use salicylic acid for patients who are pregnant and I'm trying to help them with acne. That would
Okay.
be, or in a patient who, it's a special situation, but it wouldn't be like my go-to.
Right. And I'm seeing that Valentina is here. She has a ton of questions. She has a ton of questions. She wants to know how to treat the little veins around the nose. Don't you need
So
like laser for that?
yeah, correct. You need a pulse dye laser. So pulse dye laser, that will zap it.
Back
So
acne?
Emma, yes, Emma, we can talk about you doing a rapid retinization. If you want to do it, we can give it a try. Because Emma uses a 0.1% anyway. So you might be able to do it. We'll talk about it this week. But, oh, sorry, someone just asked me about tretinoin in Poland. Tasha, are you in Poland?
She's going to possibly be.
When? From where? From
We're
California?
not sure yet. She's from Italy right now, and
Oh,
they're thinking about moving to Poland, but they're not sure yet.
okay. So Italy, you can definitely get, I'm pretty sure you can get tretinoin. Poland, I don't know, but there's really great compounding in Italy. So you might be able to get it from a compounding lab. And then one of the compounding labs in London, they will post to Italy. So, I'm sorry, to Poland. So,
Oh, they
yeah,
will. So
they
see,
will.
you're
Yeah,
all
but
set.
yeah, there's I'm trying to get the German lab to post to people in EU, because if you post from the UK, it costs a lot of money.
But she's 25 and she seriously has gorgeous skin.
Oh, then you don't
Does
need
she
a
need it?
retinoid.
Yeah, she doesn't need it. In my opinion, I think she just needs to stop using all the crap that they're sending her, because I think that's why she gets sensitive skin. And I think people just need to wake up and realize that you're gonna get blemishes, period. Period. Let that shit go.
Yeah, so Dasha, keep in contact with me, and then because I can prescribe for people in the EU. So like Nick, if you were in Poland and you needed a prescription for retinoid, if you were my patient, I could prescribe.
Oh, I'm asking for my mom. Okay.
Oh,
Okay.
right, that's right. Because if I do if someone's my patient, if I see them in the UK, then I can give you a prescription, and then you can go to a pharmacy in the EU and get that prescription filled, even though I'm not licensed in like Poland, but I'm licensed in the EU. Anyway, doesn't matter. Moving on. We have lots of questions.
So, how to treat back acne? That's a big one, right?
Yeah, Valentina, I have started doing person-to-person consultations
Okay.
for the past June. Yes,
And
I can
all these
prescribe
things
in
kind of
Dubai.
need
Sorry.
consultations,
Sorry,
right?
I'm answering questions. Can I
Yeah.
prescribe in Dubai? Yes. Yes, if you're in Glasgow, you can be my patient. We do video consult. Sorry. Anyway, back acne. Yeah, good question. I like to use high-strength benzoyl peroxide, like a 5 or 10% benzoyl peroxide for
Oh.
back.
Oh,
And
okay.
yeah, and I like to use oral antibiotics for back.
Oh,
Yeah.
okay. So there
And
you go. That's for you, Valentine Diazzi. And then also Valentine Diazzi, how to improve skin elasticity.
oh, you're gonna hate this one, retinoid. Use tretinoin.
I
So
can't argue.
yeah, tretinoin, and then stay out of the sun.
Yes.
Kinka19 saying, what about Holland? Can I buy Tret here? You need a prescription in Holland. I'm not sure if Dermatica ships to Holland. Yasmin is on this. If Yasmin is still listening, can you tell us if Dermatica ships to Holland, please? Yeah. And what can I use for chin acne? Well, let me say the same thing over and over again. Tretinoin. It depends how bad your chin acne is, what kind of acne it is. But usually I'd say like something like in Dubai, if you go to the pharmacy, you can buy Differin gel and you can buy Epiduo gel over the counter in Dubai. So just go to the pharmacy and tell them you want the special retinoid for acne. And if you don't know what it is, just send me a message and I will send it to you.
Oh, this person is actually, Nigat is asking a very, very good question about hydroquinone with Tret. So here, Nigat, before we go any further, are you saying should you continue using the Tret with hydroquinone? Because I've also heard that it shouldn't be used after 3 months. Is that true?
So that's not true. If you're getting no response to it, then you just stop after 3 months. Because if it doesn't work for 3 months, then you're not going to respond to it. To be honest, I've never had a patient not respond to hydroquinone. So that's a bit unusual. If your pigmentation is much better, then you can just stop using it or taper it down. But there is no rule with regards to how long you can use it. Where that comes from is almost certainly going to be a couple of things. One of them is the idea that the topical steroid in it, that you can't use that for more than 3 months, which is not true. And then the other one is about this idea that, oh yeah, in the NHS is that it's quite expensive, so they don't want to give it to you. So it's money. So if it's working, Nigat, if it's working, you just tell Dermatica that you want to continue it. So it should be fine. Okay. Hi, Elena. Spironolactone, does it work? I've got hormonal acne. Yes, it can work. It can work very well. You need to give it time. So spironolactone takes like months to really kick in.
Somebody's asking if Tret can reduce acne scarring, and I remember you saying no.
So that's an interesting one. I just wrote an Instagram post about that because there was a paper that came out that's now making people think that they can treat their atrophic acne scars with Adapalene. It was a decent paper, but the conclusion wasn't accurate. It's not clear to me whether or not it will take them away. I think it's not. I would always put my patients on a tretinoin anyway. So if it helps improve your scarring, then that's a fabulous side effect. But that's not why I would use it, and I wouldn't put my money on it that it would. Do you know what I mean? So you know, I would use it and hope it would help. But if you really have bad acne scarring, you probably need something else. Acne scarring.
And then somebody's asking about microneedling during Tret.
Yeah, you can do it. But I don't think there's a point. So I did an Instagram, I keep saying this. I did a post about microneedling just recently. So have a read of that because it'll explain to you why I said that it's not worth doing at home. Yeah. Is there any way to get rid of large pores? No, but oral Roaccutane will help quite a lot. How much stretch should be used on the face? 0.5 grams for your whole face. Yes, we only have 5 minutes left. Thank you, Tasha.
Yeah.
I was told dark spots cleared with hydroquinone will reappear as soon as you go back in the sun. Yes and no. It depends on what your dark spots were due to, but that's why going in the sun is not good for your dark spots,
Yeah.
especially if you've gone through the hydroquinone. So, yes.
They're definitely due to the sun.
Yeah, they definitely do the sun. I mean, yeah. What would you suggest for ice pick scars and wide pores? Oh, yeah. So I would use a retinoid absolutely if you can. And then you'd have to look at a physical treatment like a CO2 like something that's gonna ablate the epidermis and smooth out your skin. Sorry, no good answer for that. And what can I use for body? Anything you want, my dear. Whatever you want.
I think she means in terms of tretinoin.
Oh, no. Well, you can, but it's a lot of tretinoin. I've not done that with anyone.
Okay.
So, no.
Acne-Prone, history of mental health?
Yeah, so this is a kind of a long story, that one. I've treated a lot of patients with mental health issues with Roaccutane safely, but that has to be done with a conversation with the patient. So there's no really good connection between mental health problems and taking Roaccutane. That's a very complicated story, and I don't have enough time to go through it. But if you or someone you know needs Roaccutane, but they have mental health problems, you just need to see a doctor who can talk you through it and help you understand how to do that. And it's usually fine. So.
And then 2 more questions that I for Valentina, because we didn't even do these. Thoughts on sulfur for acne? And then she's also asking, I still have 2.5 months of using Dramatica and I still have little pimples and whiteheads. Should I keep trying? That one's easy. Yes, right?
Yeah, but I think you need to have, someone needs to look at your skin with that, because I saw that question earlier today and I was thinking, oh gosh, you have to, if you're still having them, I would want to see what's going on and then kind of decide what would be the best next step for you. And what was the other question? Sorry, Kat.
Thoughts on sulfur for acne?
I have no idea.
Okay, yeah. Somebody just posted above here. Oh yeah. Okay, so we got a few questions like this one too. How long should I be using tretinoin?
Forever, unless you're pregnant.
For the rest of your life, until you're buried.
Yeah, until you can't apply it anymore because you can't see your face. Yeah.
And I also like this one because this one drives me out of my mind. Sunscreen while indoors. Why are so many derms insisting that it's a must for anti-aging?
Because they're trying to sell you more sunscreen. I have no idea. I just did a post too about blue light. So I wouldn't worry about the sunscreen indoor nonsense. It's just nonsense. So
it's just health products, period.
We all
now
need to chill out about this sunscreen.
Yeah. I know that you can't stay on because of course it is late for you. So we're gonna have to. Oh, and for CTOTHENG, do people really reapply sunscreen from head to toe? Yes, but they have problems. They're being sold something that isn't true. So no, you don't have to do that. What was the other one? Face masks. Yes, face masks are a temporary effect. We already answered that.
You don't need me.
Something about a brand and its efficacy, but I don't think you know that. And oh, they want to know if it's worth the price tag. Probably not.
Probably. Oh yeah, I saw the question. No, it's not. If you have to ask, the answer is no.
Yeah, the answer is no. Copper peptides. Any truth to benefits marketed? We're gonna get cut off.
Absolutely not. Yeah, we're gonna get cut off. Do not buy copper peptides. It's a waste of money.
Okay, good. So guys, I am gonna save this. We're gonna do this again Tuesday. Send me your questions or her your questions right away. We'll go ahead and get these answered, hopefully better. But this is just so much fun, guys. I love you.
Hey guys, good.
Let me know what you want to talk more about. Dr. Natalia, thank you. I hope you sleep well. And I love you so much.
Good night. Love you too. Bye, everyone. Good night.
Bye. All right, guys. So yeah, go ahead and send in your questions. And I will post this right now if my battery's not dead. Ha! I hope you loved it. Thank you. Bye. End video.